Hi, in this video I'm going to demonstrate dry needling to a common trigger point around the thumb area. This trigger point relates to the adductor and opponens pollicis. This can be really useful for a client that might have pain around the thumb, might have restricted range of motion, or they're getting pain when they're doing lots of gripping movements. From a therapist perspective as well, this is a really useful area to needle or to self-needle, because quite often hands-on therapists, we can find at the end of the day that the thumbs can be quite achy, or around that saddle joint area or into the wider hand as well can also be quite achy. Okay, so we need to identify where the common trigger point is. Okay, so Lydia's hand is set up quite nicely here. Now we can see here, if we abduct the thumb slightly, the trigger point or the area that we're aiming for is just in between that thumb and the first finger. So quite often on yourself or on your clients, if you're experiencing thumb pain around here, around either of those joints, or an achiness in the hand, or loss of strength on the grip, if we press down in this area, quite often we'll feel discomfort or possibly pain as well. And that's the area that we're aiming for with the needle. Okay, so first of all, we want to palpate and just ask for feedback from the client. And also you'll probably be able to feel that restriction in the muscle as well. Okay, then from here, what we're going to do is we've palpated, we've felt for that area of maximal tenderness, identified where that trigger point is, and roughly the needle is going to come in a perpendicular direction down into this area. Okay, this is a site for a common trigger point, but remember we can develop trigger points anywhere within the body, so it might be slightly higher or it might be slightly lower as well on that area of maximal tenderness. The needle size that I'm going to use here is a 13mm. It's a classic plus needle. And it's one of the smaller needles, which is 13mm in length times 0.20 in diameter. So it's a guided single-use sterile needle. So with that empty tube, I've marked the point where I want the needle to go. I prepared the needle, and now from here, I'm holding the tube onto the tissue and just pressing down into the area. And then nice and quickly pushing that needle down roughly about halfway. This can be quite a strong trigger point, and often you might just need to put the needle into the area and leave that needle alone. I've got the client in a laying position at the moment because quite often, if this is a strong trigger point for the client, they might say that they feel quite heady. So it's nice to allow the client to relax in that reclined position. If the client couldn't really feel any sensation there, then we can activate the needle. And the first lighter activation method we would use is a flick. That's going to send a vibration down the needle and into the tissue. Then from there, we could turn the needle as well, and we can also pepper the needle, just moving that up and down very slightly. And we would just pepper that by moving it up and down just 3 to 4 times, then getting feedback from the client and allowing that needle to settle down, or that sensation to settle down, before we do any further activation if we need to. Ideally, we're looking for a twitch response here. If we get a twitch response, we know that that leads to rapid depolarization in the trigger point and the muscle fibers. But sometimes we might not get a twitch response here, but the client, if they feel sensation, we see erythema and have a reduction of pain or an increase of movement, that's going to help to identify whether that needle has successfully helped to reduce that tension or not. Okay, so that's dry needling to common trigger point around the thumb at the adductor pollicis and opponens area.